And then you need to know that I don't have a glove. Oh, we don't need to use the sterile gloves for this part because it's not necessary. We can just use like
normal glove.
Yeah, no, we don't have it. Green. Okay. The two things is important for you. This one is blanket, or you can open one. For each patient, you should just use one of it to put it up. Each one for one patient.
Okay.
Before we do the exam, and then we should pair the gloves. Before we do it, you should wash your hands. Just follow the 7 steps hand wash. Yeah, and then we will put on the glove. And then we will of the 2 fingers, the two one. And this is the vaginal hand, and this is the abdominal hand for most practical. And for our male doctors, you should know that you need a female assistant for you to come to the exam room. Yeah. And then for the left hand, right, the same way, the left hand, and then put it inside the vaginal. Make sure that you can touch the cervical, and then put it under the cervical, and then to make sure if there, and then just describe it, follow your book. And then the abdominal hand, we can from the umbilicus, and then to know about the size of the organ and the position, and if the patient has painful, to make sure it, you can ask the patient, do you feel any uncomfortable, and on this time, and then for the 2 part, the ovaries and the
uterus,
and then from the side, The normal things you can touch nothing actually, and if it have some myomas or others, you can maybe you can touch her. And then also you can ask the patient if she feel any uncomfortable. Sometimes for the ectopic pregnancy, and if it is broken, and it will, for the patient she will feel very uncomfortable. For very serious. And then innovate. You just need to know we should let the cervical up and down and side by side. Okay. Then take out of your fingers to make sure it have some. If it have some bleeding, maybe okay. To make sure it have maybe for the cervical cancer, maybe it will bleed. For the cervix, the patient, if you think that maybe she suffered from the cervical cancer, you should use the specular exam at first, and then maybe we can do and then for the last part, for some patients that if you need to make sure that to know the detail about the disease, you can use the last okay, and then take out the glove and throw it into the garbage. Okay. Innovate.